Welcome to the deep dive. We sift through stacks of information to pull out what you really need to know. And today, we're diving into something pretty fascinating from medical imaging: ultrasound artifacts. Now, when I hear artifact, I usually think, it's a mistake, a glitch, something you don't want.
Yeah, that's exactly the common perception. And look, ultrasound images are incredibly valuable tools, no doubt. But they often do contain these, well, artifacts,
Mm.
visual things that can look like something they aren't. Or sometimes they even hide what's actually there. But here's where it gets really interesting. If you have a sophisticated grasp of the ultrasound physics involved,
Mm.
many of these artifacts, these supposed glitches, when you know how to read them, they actually give you incredibly valuable information.
Okay, so that's the mission for you today, then. We want to unpack these hidden messages in ultrasound, explore this kind of double-edged sword nature they have, how they can mislead, definitely, but also how they can offer these really crucial diagnostic clues. Think of it as a shortcut to understanding a pretty critical piece of modern medicine.
Absolutely. Because on the one hand, you're right, misinterpreting an artifact, that can lead to serious problems. Misdiagnosing something critical like, say, an aortic dissection or maybe a clot in the heart, or it could lead down the path of unnecessary tests, maybe the wrong antibiotics, even extra radiation from CT scans you didn't need.
Right, the stakes are high. It sounds like it could be a real minefield. But you said earlier they aren't just distortions, they're inherent, part of how sound works in the body.
Exactly. And what's fascinating really is why they happen. See, the ultrasound machine, it has to make certain basic assumptions to build the image, like assuming the speed of sound is constant, typically around 1,540 meters per second,
Hmm.
and that the sound waves travel in perfectly straight lines, like laser beams.
Okay, but the body isn't uniform, is it?
Not at all. Sound hits bone, fat, fluid, muscle, all sorts of things.
Mm.
And each one affects the sound wave's speed, its path. It bends, it bounces, it weakens. So when those basic assumptions the machine relies on are, violated by the body's complexity, that's when artifacts pop up.
Okay, that makes sense. So let's get specific. Give us an example. What's a common artifact?
A classic one is the mirror artifact. Imagine you have a really strong reflector, something smooth like the diaphragm. It acts just like a mirror for the sound wave.
Like looking in a real mirror.
Precisely. So the ultrasound pulse might hit the liver, then bounce off the diaphragm, then back to the liver, and then back to the probe. The machine just registers the total travel time and assumes it all happened in a straight line. So it draws a picture of the liver, sort of duplicated, appearing above the diaphragm in the chest area.
Ah. And I could see how someone might mistake that for, say, fluid or consolidation in the lung, right?
Exactly. That's a common misinterpretation, thinking it's lung consolidation.
So how do you tell the difference? How do you know it's just a mirror trick?
There are clues. Crucially, the false image, the mirrored one, will have the exact same texture, the same tissue pattern as the real liver below it. Plus, it won't show other signs you'd expect with real lung problems, like pleural effusion fluid around the lung or specific patterns called air bronchograms. And another trick, just change the angle of your ultrasound probe slightly. Often the artifact will just disappear or change significantly. A real lesion usually won't.
Got it. So it's about knowing the physics and using technique. It's like detective work. And you mentioned, this is the really cool part, some artifacts are actually useful. They help diagnose.
Yes, absolutely. Take attenuation artifacts. This category includes things like acoustic shadowing and posterior acoustic enhancement.
Okay, attenuation means weakening of the sound wave.
Right, so acoustic shadowing. That appears as a dark signal void area behind something that strongly blocks or reflects the sound. Think of calcifications like gallstones or kidney stones, or even bits of metal. They cast a shadow.
So seeing that shadow is actually a really reliable sign that something hard or dense is there.
Exactly. It's not an error. It's a direct clue about the tissue.
Yeah.
And the opposite is posterior acoustic enhancement. This looks like an unusually bright area behind structures that let sound pass through very easily with low attenuation.
Like fluid.
Precisely. Things like fluid-filled cysts or effusions or hematomas often show this enhancement behind them. Again, it tells you about the composition. It's useful information.
Wow. And what about Doppler? You mentioned something there too.
Ah, yes, the color Doppler twinkling artifact. This one's quite specific. In color Doppler mode, which usually looks at blood flow, you sometimes see this rapidly changing mix of colors, like twinkling Christmas lights behind certain structures. Even though it is an artifact, it's not real flow. It's become recognized as a really useful secondary sign for identifying things like small kidney stones or calcified deposits.
So an error becomes a diagnostic sign. That's wild.
It really shows how understanding the why behind the image is key.
So with all this complexity, how do radiologists, the experts, actually manage this? How do they sort the artifacts from reality?
Well, it really comes down to a combination of things. Three main strategies, you could say. First is optimizing the equipment settings themselves. Second is using advanced scanning techniques. And third, critically, is integrating the full clinical picture.
Okay, so optimizing settings, like adjusting knobs on the machine.
Basically, yes. Things like adjusting the overall gain or brightness. Sometimes, believe it or not, turning the gain down in deeper areas can actually make things clearer. Or adjusting the focal zone to where you're most interested. Little tweaks can make a big difference in reducing artifact or making it more obvious as an artifact.
And the scanning techniques.
That involves things we already touched on, like changing the angle of the probe, looking at the structure from multiple windows, multiple planes, like coronal, axial, sagittal views. Sometimes an artifact is really obvious in one view but disappears in another. That's a huge clue. It requires a dynamic approach, not just taking one static picture.
Right, you have to sort of probe and test the image.
Exactly. But, even with the best technique and settings, sometimes an image can still be ambiguous. And that's where the third point is essential, the clinical context. What are the patient's symptoms? What's their history? You can't interpret the scan in a vacuum. Understanding the whole patient story is crucial to avoid misdiagnosis, especially when artifacts mimic real pathology.
So putting it all together, the big takeaway for you listening is that these ultrasound artifacts, they're just part of the deal, unavoidable. But they have this really fascinating duality. They can definitely be pitfalls, challenges that mislead, but they're also these profound opportunities, these hidden clues for getting really precise information about tissues.
Absolutely. Knowledge here is really about understanding and applying it. For radiologists who are true experts in ultrasound,
Sure.
it's not just looking at the picture, it's deeply understanding the physics of why the picture looks that way. And it's about actively using the technology, manipulating it to tease out the truth hidden within those echoes and shadows. It's both an art and a science, really decoding those messages.
Well, yeah. This whole deep dive, it makes me wonder, in our world is overflowing with data and complex information, where else might we be seeing artifacts? Things that look like noise or errors or just confusion. But actually, if we just had the right perspective, the right knowledge, they might hold really valuable insights. Something to think about until our next deep dive.